sex is very good for you. In fact, I would argue that sex is a powerful anti-aging tool in its own right. But what if you can't have sex? About 40% of men over the age of 40 have some degree of sexual dysfunction. 75% of men and at least that many women who have sexual dysfunction are currently untreated. Your brain is your biggest sex organ. It's where desire starts. One of the biggest things I see in my practice is stress. Well, apps like Rosie and Furley combine education with mindfulness to help women with low libido get into the kind of the right headspace. Another fun, techie way to improve libido is through transcranial photobiomodulation. It's been shown to be beneficial for treating depression, and there's also some evidence that this can be helpful for treating low sexual desire as well. So this is something to kind of keep your eye out for. Most erectile dysfunction is caused by lack of blood flow, but it's also a problem for women because women need blood flow too. What you can do to increase blood flow is to maintain nitric oxide levels. As you can imagine, you need nitric oxide to get blood into your sexual organs. As you get older, your nitric oxide levels start to decrease because it's made, one of the places it's made is actually inside the blood vessels. By the time you're 40, you're making about half as much nitric oxide as your 20-year-old friends. So how can we increase nitric oxide? One way is to exercise, preferably out in the sun, which is great for increasing nitric oxide. Other things like red light therapy or PEMF therapy can also be helpful for increasing nitric oxide. As we get older, of course, our hormones are going to change. Hormones like testosterone, estrogen, and progesterone tend to go down. Hormones play a role not just in keeping you interested in having sex, but also in supporting the health and structure of the sexual organs. Recent advancements in functional genomics and artificial intelligence are allowing patients to combine blood and salivary and urine hormone testing with DNA analysis of their personal steroid pathways that can give you a really much more complex and complete picture of how best to replace these hormones in each individual. Regenerative biologics, such as PRP, stem cells, exosomes. These offer us the ability to not just support the structures, but potentially to actually regenerate and restore function in the genitalia. So they essentially send signals to the cells that you already have in your tissues to make those cells more active. Stem cell injections have been able to reverse erectile dysfunction in men with things like diabetes, hypertension, aging, and prostate surgery.